So I'm going to start my presentation. Imagine you are working from home and isolated from mass people till 200 days and already stressed. How can you overcome the stressful situation? Hi, I am Mahamudul Hasan. Today, I am going to discuss about managing yourself and COVID-19 stress. Social distancing because of coronavirus or COVID-19 is the best thing we can do right now to decrease the risk of spreading the virus in our communities. But social distancing is self-isolation can be really stressful. Now I am going to share some ways to look after your well-being in this pandemic situation to release your stress. First of all, take break for the news. That means we have to sometimes we have to be far from those newses about the uh, infected persons, infected numbers, number of death. We have to take break from those newses. That means information overload can be upsetting. Make an effort to switch off your screens or the television once in a while. Then take care of your body. You have to take care of your body by meditate, eat well balanced meals, take deep breaths and exercise. Aside from staying safe, ensure that you are taking steps to keep yourself healthy. Then we have to make time to unwind our mind. That means use a few minutes of your days to do something you enjoy. Especially if you are working at home, take a short break to rest your eyes and your mind. Then we have to connect with each other, and this should be like talk to people you trust about your concerns and how you are feeling. Check on your loved ones too. It would be nice to know that you are not going through a stressful time alone. Aside from looking after ourselves, it's also important to be aware of the real risks of the virus and how we can protect ourselves and our loved ones. Then we have to plan and prepare ourselves to be safe from the virus to be affected. First of all, you we have to get the recent information about local COVID-19 activity from public officials and departments. Create a list of important organizations and providers of your household to whom you can call in case of emergencies. Choose a designated room that can be used to separate family members who are sick or under monitoring. Then take every day's preventive action. That means we have to take some preventive actions or some steps that we will follow regularly so that we can be safe from the virus. And those are: number one, wash your hands frequently. Number two, avoid touching your eyes, nose, and mouth. Number three, let family members who are sick or have underlying issues stay at home and away from the office, school, and crowded places. Number four, cover your cough or sneeze with a tissue, then throw the tissue in the trash. Number five, clean and disinfect frequently touched objects and surfaces. Number six, stay indoors as much as you can and wear a face mask if ever you need to go to outside. Then we have to stay in touch. That means stay informed about the local outbreak situation. If you live alone, ask family, friends, and healthcare providers to check on you during the outbreak. Then notify your work or school if your schedule or arrangements need to change. Stay in touch with family and friends with chronic medical conditions as well. Then take care of your household's emotional health. Outbreaks are stressful for both adults and children. Especially, children may respond differently to stressful situations. So you have to talk with your children and answer their questions. Let them voice out their fears and worries. Practice meditation as a whole. Finally, the situation may be overwhelming, but coping with stress will make you, the people you care about, and your community stronger. Thanks for being with me. Have a good